Hi, everybody. Just wanted to make a video to go over the comprehensive health assessment assignment that you have to do this semester. So this will be your one big project for the semester. It is worth 20% of your grade, and it is due by 11:59 on February 23rd, which falls within week 7 of the course. You do not need to wait until then. So if anybody wants to get a head start, you can. That's why I wanted to make sure you have this video early on. There are also some resources for you to help you with this. The Anna Maria writing resources, which I'm going to show you how to access through the course, as well as a direct link to Purdue OWL to help you with APA formatting. One question I've actually already gotten from students, because there is a very extensive directions as well as rubric. One thing that is not on the rubric that students have already asked me is related to the length of this paper. There is not a set length, okay? So the directions are that you take as many pages as you need in order to comprehensively answer all of the questions that are in the rubric and in the directions, okay? So without further ado, I am going to share my screen and we're going to take a look within the course. So within the course, if you go to week 7, okay, you're going to see here several things. First of all, you're going to see oops, I'm sorry. Actually, you know what? There is not a Dropbox for this yet, but this is just a Dropbox for the assignment, but there will be a Dropbox here as well for you to submit the assignment. But this is where you're going to find where you have found this video. This is also where you're going to be able to click on simulated patient A and simulated patient B. Before we click over to the directions for this assignment, I do want to just point out to you as well, within our scholarly writing resources tab here, you can click on the Anna Maria College writing support. And if you click on this click on this link right here, you will see all kinds of resources here to help you. You can click through. You're also going to see here, if you go back to the site as well, a link directly to the Purdue OWL website. And I know I've shown many of you this before. There's a lot of resources on here and ways to use this. Some of my favorite is going to be, and you're going to be doing an APA paper that is a student version and following those rules. But one of my favorite things on here is to open up a sample paper. And when you open up the sample paper, it's going to give you general rules. But you can also look at just the student paper, okay, and you can down that as well. And what I say is you always want it to match and be able to mirror the paper that you're doing. Okay, so the sample paper. But now that you're moving on and you're going to be writing longer papers and having more types of resources on your reference list for citations, you might want to take a peek where these have individual directions on how to cite and reference different types of things other than just journals, okay? And the basic rules for the reference list is also right here, which is also very helpful, and the in-text citations. So all of those things are going to be helpful to you as you're working on this paper. Okay. So I want to take us now, we're back on the site, but I actually want to take you to the syllabus. And when you open up the syllabus for the course, at the end of the syllabus, you're going to see the comprehensive health assessment assignment here. So this overview, the assignment overview, and I'm not going to read you the entire thing, but this is really going to show that you can put it all together, that you can do a comprehensive health assessment, that you can integrate evidence-based practice, technology, leadership, and systems-based thinking, okay, all while maintaining professionalism and understanding ethical standards. You're going to be able to complete this assessment in one of two ways. So for those of you who are already currently practicing and you have a patient that you could use as your patient, then you can take a patient from your current clinical practice and of course maintaining HIPAA compliance, and you can do a thorough comprehensive health assessment, which then you're going to analyze your process in assessment and the findings. If you are not able to have a patient in from where you're working, then you can also use a simulated case study patient. And this is, there are two options. Those are the ones that I was showing you. You could click on under week 7, simulated patient A or B, and I'll click on one of those in just a minute to show you that. And so if you're going to use one of the simulated case, you're going to still simulate and pretend that you're doing a comprehensive health assessment based on the information on the case and analyze your assessment process, what your proposed approach would be, and you're going to analyze what you anticipate the findings would be based on that scenario. Okay, so why don't I take a quick look at that? So you'll see there's a patient case scenario A and B. And on A, it's an adult patient with type 2 diabetes and hypertension. So much like you would have on your patient, if you had a live patient where you would go in and you would read their chart and learn about the patient demographics, their chief complaint, what brought them in, the present illness, what their past medical history, their meds, allergies, family history, social history, and then you'd have a review of systems, okay? So this is going to be kind of your findings of a comprehensive assessment, physical exam findings, okay? So you could use this simulated patient if you did not have a patient that you felt comfortable doing a comprehensive assessment of. And standardized patient case scenario B is set up the same way, but you have an elderly patient with early stage dementia and some mobility issues. So either way, you could have a patient, whether you have a live patient or you use case scenario A or B to come up with a patient to write about. I'm going to go back to the syllabus now, and you're going to see for this assignment, there's several learning outcomes, but applying evidence-based practice principles to health assessment, navigating ethical and legal considerations in patient assessment, utilizing healthcare technology effectively, demonstrating leadership in interdisciplinary collaboration, understanding systems-based healthcare delivery, and practicing within the BSN scope of practice. The directions go on here and further detail that this comprehensive health assessment, which I just reviewed, is worth 30 points out of the 100 for this entire assessment. So for option A, if you have an actual patient, you're going to do the assessment, you're going to document all your findings, and you're going to integrate at least 2 technological tools that you used in your assessment process. If you use B, you're going to first select either A or B, a simulated patient. You're going to also complete the detailed health assessment required, including required assessment components, propose the order of assessment that you would do, anticipated findings, and any potential challenges or solutions. You're also, for both cases, for whether it's a live patient or a simulated patient, you're going to document your planned assessment using the provided EHR simulation template, which actually I don't see on the website yet, but we'll make sure that that is posted for you. And you're going to integrate at least 2 technological tools that you use in this assessment. So that is going to be the whole first part 1 of this assignment. Part 2 is going to be the actual paper, and this part is worth 70% of your grade, and you're going to write a paper analyzing your assessment process and findings. And for option B, meaning you used one of the case scenario patients, you're going to focus on your planned approach and anticipated findings. And here you're going to see it's broken down, and it's also on a rubric, which I will show you, but it's broken down into sections. So number 1, you're supposed to be writing about evidence-based practice, and this is worth 10 points of the paper. And you are going to follow and answer all of these questions. So you want to make sure you discuss 3 current evidence-based assessment techniques, cite relevant nursing research to support your assessment methods, explain how scholarly inquiry informed your assessment decisions. And that is going to be for people who had a live patient. And for option B, you're going to discuss how you would apply these concepts in practice, explain your clinical reasoning for anticipated findings, address your potential challenges or solutions, and provide evidence-based rationale for your planned approach. Number 2 is going to be also worth 10 points, and you're going to be looking at professional and ethical considerations. Now, I read all of number 1 to you, but I think you can read this on your own. But For number 2, A, B, C, D is, oh, I'm sorry, A, B, and C is going to be for people who are doing this on a live patient, okay? And for option B, meaning you used a case study patient, you are going to be going through and answering these 1, 2, 3, and 4 questions. For number 3, you're going to be looking at technology integration, worth 10 points. For option A, you're going to answer the questions A, B, C. And for students who choose option B, you're going to answer questions 1 through 4, and so on and so forth, okay? Doing 10 points looking at leadership and collaboration, and the same, option A, answer A, B, C. Option B, answer 1 through 4. Number 5 is system-based practice. Option A, answering A through C, and option B, answering 1 through 4. And lastly, for number 6, professional role analysis, option A, answering A through C, and option B, answering 1 through 4. Requirements of this paper is that you follow the 7th edition of APA format. You need to use at least 3 scholarly sources that are from the last 5 years. It should be clear professional writing, integration of course concepts and terminology, and it should be HIPAA compliant for all patient information. You're going to submit both the health assessment documentation and the paper. So the assessment documentation is worth 30 points and the analytical paper is worth 70 points for a total of 100 potential points. You're going to include all references and appendices as needed. And it's going to be due, like I said, by 11:59 on Sunday, February 23rd, which is week 7. Grading of this paper will be evaluated, and you'll see for each section based on the depth of analysis, integration of evidence, professional writing, application of course concepts, and critical thinking is demonstrated. As always, with academic integrity, all work must be original and properly cited, and plagiarism would result in a course failure. On the next page here, you can see the grading rubric, and you can see for part 1, 30 points, and you can see to receive 30 points, these are the expectations, and it goes down from there. For part 2 in the paper, you can see the 6 areas that you're going to be writing to that are all worth 10 points. And again, tells you in order to be exemplary and get the full points for each one of those categories, what you should aim to do. There's also one area for APA format, grammar, and overall style that's worth 10 points, and that will give the total of 70 points added to the total of 30 points potential for the paper for 100% for this paper. That is all the instructions. It's pretty comprehensive, but certainly please do reach out should you have any questions. Again, this is going to be due in week 7. You will have a Dropbox for this assignment. In addition to the simulated patients, I believe we're also going to have a template for you to document your EHR. So I'll make sure that gets put in here. Again, if you have any questions, please feel free to reach out. If there's anything more that I learn about this assignment, certainly I will share with you all as soon as I find out, okay? I hope you guys have a good time doing this assignment, and I can't wait to read all of your papers.